Welcome everyone to the Canadian Nurses Association webinar series, Progress in Practice. This webinar is about supporting ecoliteracy in nursing practice. This session is being recorded for nurses who are unable to participate today. My name is Ashley Chisholm. I am a research and policy advisor at the Canadian Nurses Association, and I will be hosting this webinar. At the end of the presentation, we will answer your questions, which you can type in the Q&A box that you can bring up by hovering your mouse at the bottom of your screen and clicking on the Q&A button in the toolbar. We will address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. And now a little bit about our presenter, Jennifer Morin. Jennifer Morin worked in the acute care oncology setting until 2009. Then she became a nurse educator with Red River College. Her teaching background includes, but is not limited to, acute health, clinical practice, law and ethics, and health assessment. Currently, Jennifer is the course leader for interprofessional practice and interprofessional education. Jennifer has been a member of the Canadian Association for Nurses in the Environment since its inception in 2009 and is the current president. As a result of her work with CANE, Jennifer was awarded Outstanding Individual in an Organization from the Canadian Network for Environmental Education and Communication. In 2014, Jennifer joined Health Canada and the College of Family Physicians of Canada as a champion in the dissemination of information related to climate change and extreme heat, air pollution, and the Air Quality Health Index and Radon. She is involved with the Public Health Agency of Canada Committee for the Education of Health Professionals on Zoonosis and Climate Change, and will participate in the Canadian Association of Schools of Nursing Stakeholder Forum for the project Empowering the Next Generation of Healthcare Professionals with Knowledge, Skills, Tools, and Supports to address infectious disease related to climate change in Canada. So now I'd like us all to welcome Jennifer.
Good morning. Thank you, Ashley. So on this slide here, you can see there are 3 broad learning objectives listed for today's session. I hope to provide an overview of the work currently underway that will support Canadian nurses' ecoliteracy in relation to climate change. I will provide a brief overview of climate change and the related human health impacts in Canada while identifying opportunities for engagement in climate action, mitigation, and adaptation. The Canadian Association of Nurses for the Environment, also known as CANE, represents nurses dedicated to the improvement of environmental health across all domains of nursing practice, policy, research, and education. A member of the Canadian Network of Nursing Specialties, CANE works to facilitate knowledge sharing and transfer based on environmental health principles and nursing best practices. CANE recently underwent a name change and was previously known as Canadian Nurses for Health and the Environment. Please note that references are included throughout the slide deck and that the numbers correspond to the numbered reference list that will be emailed following the presentation. In 2017, CANE, as CNHE, put forward a resolution at the CNA annual meeting of members titled Supporting Ecoliteracy for Current and Future Registered Nurses in Canada, asking that the Canadian Nurses Association make a concerted effort to increase the ecoliteracy of the future and current nursing workforce to address the increasing concerns related to environmental health. The expected outcomes listed in the resolution were that CNA, in conjunction with the Canadian Association of Nurses for the Environment revise and redistribute a previous survey from 2008 titled Nurses and Environmental Health. As a result of the resolution put forward to CNA, the two associations collaborated to review and revise that 2008 survey. That 2008 survey, some of the findings of that survey were that there was more training required to support nurses' work in the area of environmental health, and recommended that there would be increased curricula at both the undergrad and graduate level. The revised 2019 survey has several aims, including identifying nurses' awareness, level of education, use of teaching resources with patients, clients regarding environmental health, and their perception of the impact the healthcare system has on surrounding ecosystems. Survey findings will assist in identifying knowledge and practice gaps and will support the development of ecoliteracy in the nursing profession with educational resources to address these gaps for nurses at various practice levels in Canada. The expected timeline for distribution and data collection and analysis is between June and September 2019. Next slide. An additional expected outcome listed in the resolution was that CNA have an ongoing dialogue with CAUSN to discuss the potential for the increased infusion of content that would support a higher level of education related to ecoliteracy among the future and current nursing workforce. The Canadian Association of Schools of Nursing have recently obtained funding from the Public Health Agency of Canada to develop national evidence-informed consensus-based guidelines on climate-driven infectious disease for nursing education. Next slide, please. At this point, you might be asking yourself, what is ecoliteracy? Ecoliteracy can be defined as the ability to identify, classify, and name different aspects of the environment, but also includes the ability to take action and participate in the decision-making process of environmental problems and issues. Advancing ecoliteracy will ensure that the nursing profession has the knowledge, attitudes, and skills required to address principles of sustainability and ecology within the health sector. Next slide, please. The Canadian Nurses Association supports the nursing profession's involvement in climate change as it relates to human health, recognizing that nurses are well positioned to support adaptation efforts and that nurses have a role to play in protecting the health of the planet. The International Council of Nurses is a global voice of nurses with a mandate to advance the nursing profession, promote the well-being of nurses, and advocate for health in all policies. In 2018, the ICN released their position statement titled Nurses, Climate Change and Health. The ICN highlighted the powerful contribution nurses can make for climate mitigation and in supporting people and communities around the world in adapting to the impact of climate. The ICN also identified the demand for well-educated and trained nurses as climate change is likely to increase the incidence and prevalence of non-communicable diseases across the globe. Next slide, please. As the area of environmental health and the relationship to human health has evolved, so too has the language used by researchers to describe the subject area. Florence Nightingale believed in the contribution of environmental factors to health and well-being. She argued that a healthy environment was important to healing and that the provision of fresh air, clean water, adequate sanitation, good food, quiet, and cleanliness was essential to patient recovery and that health was more than the absence of disease. There are various terms used to describe this relationship that can be seen in the literature, each with its own nuances, and often terms are used interchangeably. The terms commonly used are environmental health, ecosystem health, ecological health, and planetary health. The term planetary health was most recently introduced and arose from the work of the Lancet on climate and health to reach a deeper understanding of the interdependence of human and natural systems. Planetary health recognizes that the health and well-being of humanity are inextricably linked to the health of the Earth's natural systems. Next slide, please. The Lancet Commission on Climate was a major catalyst for the realization of health professionals as key players in climate awareness and action, framing the issue as the biggest public health opportunity of the 21st century, recognizing that actions for climate mitigation lead to benefits for human health. The Lancet report identifies the voice of the health profession as essential in driving forward progress on climate change and realizing the health benefits of this response. Health professionals are uniquely positioned to communicate the urgency of climate as a health priority and promote climate solutions as directly beneficial to human health and well-being. Next slide, please. In February this year, a call to action was put forward on climate change and health, led by CAPE, the Canadian Association of Physicians for the Environment. The collaboration called on all federal parties in Canada to see climate change as the greatest health threat of the 21st century, also identifying that many of the policies needed to fight climate change will produce immediate health benefits, reduce healthcare costs, and improve social cohesion and equity in our communities. The Canadian Nurses Association was an essential partner in this collaboration, promoting the role that nurses can play in advocating for climate action. And we had representation from CANE present at that event as well on Parliament Hill. This webinar aims to highlight some additional ways that the nursing profession can assist in producing health benefits for the populations they provide care to. Next slide. Now, having reviewed some of the literature that supports ecoliteracy in nursing education, let's briefly review the impact climate change has in a Canadian context. The center ring of this image shows the cycle of increasing carbon dioxide, which leads to rising temperatures, more extreme weather, and rising sea levels. The next ring highlights 8 primary global effects that occur due to warmer temperatures, extremes in weather, and higher sea levels, such as extreme heat, air pollution, increasing allergens, changes in vector ecology, and impacts on water and environmental degradation. Next slide, please. This map gives an indication of some of the health risks associated with climate across Canada. The risk in terms of exposure has some variability depending on the regions where individuals live, as well as their socioeconomic status and access to support networks. Northern Indigenous communities are at particular risk with melting permafrost, loss of traditional hunting grounds, and food sources, exacerbating the pre-existing health and socioeconomic inequalities. Flooding in Quebec and the Maritimes, forest fires in BC and northern Alberta, droughts in the prairies are all having significant effects on Canadians in terms of their physical and mental health, their livelihoods, their sense of place, their ability to plan their lives for now and into the future. A new report published in April 2019 from Environment and Climate Change Canada in collaboration with Fisheries and Oceans Canada, Natural Resources Canada, and university experts provides a robust and wide-ranging assessment of climate change in Canada. And they break down this information and this assessment by the various regions across Canada. So you could access the resource to identify what your particular region is experiencing in terms of climate change. These last 2 slides highlight the impact Canadians are currently experiencing in relation to climate change. And so now I would like to draw your attention to the specific effects of climate change and the impact on human health. Extreme heat is something that many Canadian provinces have experienced. This graph highlights the current and projected number of days exceeding 30 degrees Celsius for a number of large Canadian cities. You can see an increasing number of hot days for each Canadian city identified in the graph, and the graph shows the number of days with a maximum temperature of 30 degrees Celsius, and that number is projected to double in the next 5 to 20 years and more than triple by 2081, likely resulting in further heat-related mortality. On the right-hand side of the graph, there is an image that demonstrates the sustained nighttime temperatures above 22 degrees Celsius. And this is significant as sustained nighttime temperatures above 22 degrees Celsius will not allow an individual's body to get some relief at night from the heat if they don't have access to a cooled area. Overall, Canada is projected to become much warmer, and urban areas tend to experience higher temperatures due to something known as the urban heat island effect. The urban heat island effect is a phenomenon where the temperature in an urban area is hotter than that of surrounding rural areas. And this occurs because there is minimal vegetation cover and a high percentage of dark surfaces such as parking lots. Some recent Canadian statistics from Montreal. In 2010, there were 106 deaths in the city that had been attributed to a heat wave, an extra 3,400 emergency department visits. As well, in 2018, Quebec reported 93 deaths during a July heat wave. And it is important to note that Quebec is the only province in Canada which monitors heat-related deaths in real time. Those who died were primarily people of low income, older adults, and those with mental health or dependency concerns, and many were living in areas that were experiencing heat islands. While in Ontario that same year, so in 2018 in Ontario, summer temperatures had exceeded 30 degrees Celsius for 21 days straight, which required the city to establish cooling centers for communities across the Greater Toronto area. Reviewing various heat-related illnesses is important with the anticipation of prolonged heat events in our communities, placing great emphasis on understanding the difference in treatment between exertional heat stroke and classic heat stroke. If you could just go back a slide, Elizabeth, sorry. Exertional heat stroke is often caused by physical exertion in high temperatures, whereas classic heat stroke more often affects sedentary individuals and persons who are chronically ill or very young children. So reviewing some of the health effects related with extreme heat, in addition to heat stroke and heat exertion, reviewing content related to skin rashes, cramps, dehydration, and just advising clients that they should be moving to a cool place and drinking liquids right away and seeking medical attention if heat stroke is suspected. Aside from extreme heat, we are seeing increasingly severe weather events. Next slide. More frequent and violent thunderstorms, increased drought in some areas, affecting water supplies and agricultural production and contributing to wildfires. Extensive flooding in Quebec during April and May of this year is said to have been exacerbated by climate change. A very cold winter with a cocktail of weather events such as icy conditions and a lot of snow in the late spring did not allow for the melting snow to be absorbed into the ground. Some possible human health effects that are linked to severe weather in extreme cases include death and injury, psychological effects, and the indirect health impacts from ecological changes to infrastructure and interruptions in health services. As nurses, it is important for us to consider the impact extreme weather events can have on healthcare infrastructure, For example, patients were relocated from a number of hospitals and continuing care centers in Alberta and Saskatchewan in 2013 and 2014 due to widespread flooding. The flooding led to 24 communities declaring local states of emergency. And in 2007, Regina General Hospital in Saskatchewan experienced approximately 8 days where only life-critical surgeries could be carried out due to extreme levels of humidity and high temperatures. Next slide. Air pollution is becoming a well-researched area of environmental health and climate change, and there is numerous findings supporting the negative impact on human health. Air pollution is composed of nitrogen dioxide, mainly from motor vehicle exhaust, ground level ozone that is formed due to reactions between compounds and the atmosphere. The concentration of ozone increases in hot, hazy summer weather due to slow moving air and strong sunshine, speeding up the formation of ground level ozone. Another component that makes up the air pollution mixture is particulate matter. Major sources of particulate matter include fuel combustion from motor vehicles, marine vessels, rail transport, aircraft, and any other burning processes, including waste incineration. Particulate matter 2.5 can also be increased when wildfires are present, and across Canada in recent years we have heard of significant issues related to wildfires. Aside from asthma, air pollution, primarily particulate matter, can contribute to cardiovascular disease. It is recommended that all patients with cardiovascular disease be educated about the effects of particulate matter on their health and the importance of monitoring the air quality health index when going outdoors, and to think about reducing exposure through rescheduling events or limiting activity when the risk is high. Next slide, please. There is an extensive body of evidence linking exposure to outdoor air pollution and health effects. The health effects are considered according to short-term exposures to pollutants of hours, days, or weeks, or long-term exposures in terms of months or years. The effects of short-term exposure include exacerbation of pre-existing respiratory disease, especially asthma and COPD, and pre-existing cardiovascular disease, including ischemia and heart failure, and increased hospitalization and emergency department visits. Long-term exposure, which relates to where you live, work, and play. Long-term exposure to air pollution is associated with increased mortality, as well as increased incidence of lung cancer and pneumonia, and the development of atherosclerosis. Although previously it was understood that air pollution led only to the exacerbation of asthma, there is now evidence from cohort studies that long-term exposure to air pollution might lead to the development of reproductive effects, new onset asthma, as well as delayed development of the lungs. An emerging concern related to climate change is the impact on the ecology of vector-borne diseases. Climate is a major factor that may influence disease, transmission cycles, and disease occurrence. Changes in temperature and humidity can affect where vectors proliferate, can change the biology and ecology of various disease-carrying insects, ticks, and rodents, leading to a faster maturation for pathogens within insects and tick vectors, and a longer disease transmission season. Vector-borne diseases may occur for various reasons. Another concern is related to zoonotic diseases, and these are diseases that are spread from animals to humans or vice versa. And the transmission of zoonotic diseases occur through direct human-animal contact or through ingestion with contaminated food or water. Lyme disease and West Nile virus have become more common in Canada in recent years, and Lyme disease is emerging in new areas of Canada due to range expansion of the tick vector, which has also signaled concern for the emergence of additional zoonotic diseases that have been listed on the slide. Increased surveillance for new and re-emerging pathogens and vectors and coordinated efforts among sectors will aid in early detection and timely public health response. Changes are also occurring to aeroallergens, such as pollens from trees, grasses, or weeds, molds, and dust mites are airborne. These are known as airborne substances that can trigger allergic responses. Increased aeroallergen formation has been associated with exacerbation of respiratory diseases such as asthma and COPD, and have also resulted in increased hospital admissions. Next slide, please. In Canada, waterborne disease outbreaks have been linked to extreme weather events, particularly heavy rains and drought, and to increased temperatures. Air and water temperatures, precipitation patterns, extreme rainfall events, and seasonal variations are all known to affect disease transmission. With the recent flooding in Ontario and Quebec, some communities were left with contaminated water. Much research has been completed on the impact of microbiological contamination leading to diarrheal disease, and these same extreme weather events can all affect chemical contamination of our waterways. Chemical contaminants such as pesticides and other agricultural and industrial runoff can increase in waterways as a result of flooding, storms, and increased precipitation, leading to the potential for chronic health problems. Environmental degradation can lead to forced migration, civil conflict, and have severe mental health impacts. Forced migration may occur for an individual and, in some cases, for an entire community in order to avoid flooding, fire, drought, or to find fertile land for farming. In some cases, civil conflict can occur as a result of environmental degradation and is most often associated with changes to the economy. The physical health impacts of climate change have confounding implications for mental health, such as when individuals struggle with chronic disease that is further exacerbated by climate change. We can think back to air pollution and cardiovascular disease or respiratory disease. So when that occurs, or when an individual has lost physical infrastructure, such as their home or their business, to severe weather, oftentimes there are mental health implications that need to be taken into consideration. Disaster-induced cognitive and emotional issues may manifest in the form of concentration and memory loss, learning disorders, anxiety, acute stress disorders, PTSD, depression, sleep difficulties, aggression, substance abuse, and high-risk behavior in adolescents. In order to assist you as a healthcare professional to protect your patient population from the health impacts of climate change, we can start by highlighting who is at risk. Infants and young children, the older adult population, especially individuals over 75 years old. We need to take into consideration living circumstances, especially in relation to extreme heat and severe weather. It is important to consider an individual's mobility. Is the person confined to a bed? Are they socially isolated, malnourished? Do they live in poverty or have reduced access to cooling options or safe housing? People with chronic physical or mental health conditions are put at an increased risk, as are outdoor workers and athletes who compete or train outdoors. Individuals who take medications that are known to interfere with thermoregulation have the ability to predispose that individual to heat illnesses. So understanding the various mechanisms by which medications alter the body's thermoregulatory response is important to healthcare providers, and something that the literature says is often overlooked. Not only do healthcare professionals need to know about the health impacts of climate change in general, but they need to be aware of how the healthcare sector is contributing significantly to greenhouse gas emissions through their energy-intensive operations. I mentioned earlier about how the health sector could be impacted by climate change, but it is also very important to note that the health sector contributes largely to greenhouse gas emissions. In 2003, it was estimated that hospitals alone in Canada emitted approximately 2.8 million tons of greenhouse gases. Some ways that the health sector contributes to greenhouse gas emissions include through their supply chain and materials management, waste removal and treatment, energy use for heating and cooling, and water use. There's waste anesthetic gases that will be released into the atmosphere, food services and the associated meat production and transport of food contributions to greenhouse gas emissions. As well, we need to think about employee commutes. So these are some of the areas that nurses can advocate for and be involved in terms of mitigation and adaptation activities. Climate-related hazards are expected to create risks that can disrupt healthcare facility services and delivery. The World Health Organization has called on the health sector to prepare for climate change impacts through efforts to increase resiliency. A resilient healthcare facility is one that commits to sustainable practices such as water and energy conservation, promoting active transportation and local food procurement. So you may have heard throughout the webinar these terms discussed: adaptation, mitigation, and resiliency. So this slide here does have the definitions of those terms available for you. Climate change resiliency is another term that is used to describe the capacity for systems to sustain shocks and maintain the integrity of functional relationships in the face of extreme weather events. Canadian nurses must promote climate change adaptation, and that is responding to the effects of climate change, and mitigation, and that is taking action to reduce it. Carbon pricing has been identified as a strategy for mitigation. It works to incentivize behavior change, and I do anticipate that this topic of carbon pricing will be a hot one in our upcoming federal election. Carbon pricing begins to capture what are known as the external costs of carbon emissions, costs that the public pays for in other ways, such as damage to crops and healthcare costs from heat waves and droughts, or to property from flooding and sea level rise, and tie them to their sources through a price on carbon. A price on carbon helps shift the burden for the damage back to those who are responsible for it and who can reduce it. The carbon price also stimulates clean technology and market innovation, fueling new low carbon drivers of economic growth. And there are two types of carbon pricing. There's a cap and trade system that aims to cap the total level of greenhouse gas emissions and allows those industries with low emissions to sell their extra allowance to larger emitters, whereas a carbon tax directly sets a price on carbon by defining a tax rate on greenhouse gas emissions, or more commonly on the carbon content of fossil fuels. Next slide, please. So some additional opportunities for action related to adaptation strategies by the nursing profession are listed on this slide, directly related to extreme heat. Recently, we have seen the use of cooling centers. As I had mentioned, in the Greater Toronto area, I believe during their heat wave, they had set up 7 cooling centers during that time. There's also infrastructure development that reduces the urban heat island effect, which nurses could advocate for. We do, as a healthcare profession, need to provide consideration to populations and groups of individuals who have an increased risk of exposure, and also to ensure that we are providing education to healthcare providers, individuals, and families that is required in order for them to adapt to the changes in climate we are seeing today and into the future. Next slide, please. Adaptation strategies in relation to air pollution can include relocating to areas with clean air. For some individuals, this might mean moving an exercise routine indoors during times when the air quality is poor, or rescheduling exercise for a time of day when the air quality has improved. Individuals are encouraged to access the Health Canada Air Quality Health Index and to know their number and to determine their risk and sensitivity to air pollution. Vector-borne illnesses will require further education, not only for healthcare professionals, but again, for individuals and families. Education about vector control in terms of range expansion. So new areas in Canada who have not previously been affected by some vectors will require information related to adaptation strategies. Being aware of medical prophylaxis, so whether or not, I guess some studies have indicated that prophylaxis with a single 200 milligram dose of doxycycline is given after a recognized tick bite from an infected tick. Is highly effective in preventing the development of Lyme disease, so ensuring that healthcare professionals are aware of the evidence that exists in terms of prophylaxis and treatment, as well as what type of treatment options and vaccines are available for our patient population. So today's webinar only skimmed the surface on the health impacts of climate change. It is a very broad topic, and we can only cover so much in a short period of time. To further increase your eco-literacy, I would suggest consider joining a professional association such as the Canadian Association of Nurses for the Environment. As a member, you can connect with individuals from across Canada who are participating in various initiatives, and this slide highlights some of the work that is being done across Canada by our membership and the executive. So myself and a colleague are going to be presenting an education program for family nurses about environmental health. Helen Boyd in the Comox Valley is really largely involved in her community in promoting a plastic bag ban and the removal of single-use plastics in the community. Marilyn Tover and Heidi Guai has joined a green team and is very interested in having or assisting that community to reduce their reliance on diesel energy to fuel their health center and to form a solar energy project. Wanda Martin in Saskatchewan has been involved with the Canadian Federation of Nurses Union and has a publication expected to be out in June related to climate change and health. And Fiona Hanley, who is here with us today, has participated with CAPE at Parliament Hill back in February, as well recently in Montreal at a press conference called Code Blue for Health Climate. So there are various initiatives occurring across the country and lots of upcoming information for individuals to access as well outside of the professional association. Next slide, please. So some upcoming reference material. As I had mentioned earlier, the Canadian Association of Schools of Nursing will have some information available for nurse educators to include an undergraduate curriculum related to infectious diseases. And so that kit will be coming available in the coming year or two. As well, the Public Health Agency of Canada has a committee that has a mandate to build capacity among healthcare professionals related to the management of zoonoses through the identification of best practices. And so there should be some knowledge translation activities coming out as a result of that project. And the Quebec Order of Nurses has a newly formed committee on climate change, and the International Secretariat of Nurses of the Francophone community will launch a position statement in June of 2019. So there is a lot of really great momentum right now in terms of access to information and projects and funding available for projects within Canada. Next slide, please. So we also did include some web resources that are available for nurses to access. They are available on this slide here. via hyperlink. So again, I'd like to thank you for your interest in today's webinar. This is just a brief introduction to the topic, so I would encourage you to get involved and to review some of the web resources available to find further information relevant to your practice setting. And I believe Ashley will now facilitate the discussion portion of the webinar.
Thanks for your presentation, Jennifer. Definitely lots to think about climate change after your presentation. It was fantastic. Before we move on to the Q&A period, we'd like to ask that participants answer a couple of short survey questions about today's webinar. While we're waiting for the results, we will move on to the Q&A. So the first question I have is, what are some ideas for teaching my patients or clients about climate change and health?
Sorry, could you repeat the question again? I just looked at some of the questions in the Q box, so I got a bit distracted.
Oh yeah, it's what are some ideas for teaching my patients or clients about climate change and health?
Okay, so I think it depends on really which clinical setting you're working in, but I largely believe that if you're working in a setting dealing with individuals who are affected by respiratory disease, cardiovascular disease, or diabetes, then certainly teaching in relation to the use of the Air Quality Health Index would be particularly relevant. And so the message that Health Canada and the individuals involved in that information and the use of the Air Quality Health Index are really encouraging the patient populations not to avoid exercising outdoors, because the benefits of exercise really are something that we do want individuals to still experience, and we don't want to move individuals away from exercising, but it's just being aware of the impact of air pollution on their health. So getting in the habit of checking their quality health index, knowing how their body responds to air pollution. Do they need to increase the use of their medications to control their symptoms? And so to work in close collaboration with a physician or a nurse practitioner in terms of medication control as well. So that's one piece in terms of, if you are dealing with a patient population that is experiencing chronic health conditions such as cardiovascular disease or respiratory disease.
Great, thanks, Jennifer. Another question I have here is, how can we encourage hospitals to stop using one-time use plastic or styrofoam?
Right. I think that is a very tricky question, but we do have a lot of resources available for us. And so in my experience, oftentimes the rebuttal argument comes back to infection control practices, and that, that's the issue. But there is a program, or there's a concept called environmentally preferred purchasing, or EPP. And so it is quite well established, and there is the Coalition for Green Healthcare, as well as Healthcare Without Harm, I believe, in the US, that has access to various resources and materials that hospitals can introduce into their practice setting that will help to reduce some of the use like the single-use plastics. And so a lot of the time it does go back to economics as well. And so going back to, maybe using linen, some sort of linen and autoclave process and water, so for cleaning sterile equipment rather than using a single-use package. So it is it often does relate back to economics, but from what I've heard, and there's some statistics on the website offered through the Coalition of Green Healthcare, is that oftentimes when hospitals start to initiate these greening practices, there are economic benefits for that hospital. And so if you are involved in a green team and starting to formulate an argument and as to why we should move away from single-use plastics, we need to look at, is there a product available that would be appropriate for the setting, and what is that product, and then what are the economic benefits to the organization for putting that product into place. So oftentimes you need to have that discussion ready to have with the administrative team in order to move forward with those ideas. But I would definitely encourage all nurses to try and get involved in a green team at their hospital, because we certainly see different aspects of the process that some other individuals don't necessarily see in their day-to-day practice. And so we do have a valuable message to contribute to that conversation. And it is really very much a collaborative discussion that does need to take place. Hopefully that.
So just going through the next question. What are some strategies to increase engagement of nurses in academic settings where nursing curricula are annually revised? Sometimes nurses question where they fit in, and it can be difficult to state the importance of their involvement in multiple areas, and to especially encourage existing academics to make it mandatory to incorporate climate change and health impacts in nursing education.
Oh, well, this is a question, I suppose, that is near and dear to my heart. It's something that I am very passionate about myself, and that, I think hope to kind of raise awareness about. And there are mixed reviews, and I still do talk to colleagues in academia that, don't necessarily see the relevance or the importance of including content that would support ecoliteracy in undergraduate nursing programs. However, I think that we can quite, in one respect, a way to kind of increase engagement amongst academics would be to even do a lunch and learn or an article review, something that, maybe speaks to those chronic diseases that are putting individuals at an increased risk of experiencing health effects related to climate change, so that they can see that, there is a relevance to the acute care setting and to, a large portion of our patient population. So doing an article review, trying to, increase their understanding about the content area, because I do think that there is still a large disconnect about the impacts that climate change have on human health. And so oftentimes people or individuals might still have the impression that climate change is a topic that hasn't been confirmed at this time. So they might be known as climate deniers in a way. And so my discussion is always that, well, we know that climate change is happening. We don't need to necessarily say why it's happening, but we do know that there are human health impacts related to those changes that are occurring. And we as nurses have a responsibility to our patient populations to, provide adaptation and mitigation and resiliency materials related to that. So trying to move the discussion away from, the science necessarily related to whether or not climate change is occurring, and talking about, the human health impacts that are related to it, and trying to find a place that is of interest to them, meeting those individuals where they are at, because then the content will have meaning for them, and they will be able to take that discussion forward, and they'll be able to see relevance in it. And so sometimes it is small, conversations at the water cooler, right, that can even get an individual starting to think about how they might include this content into their practice setting. And it could be a small thread throughout a nursing program, or it could be a class assignment that maybe has environmental undertones. And so I think in the coming years, we might even see schools of nursing perhaps considering using an ecological pedagogy or an ecological framework in guiding the development of their nursing program. So it may not necessarily be something that all nursing programs do, but it could be something that a nursing program really kind of considers the foundation of the development of their curriculum. And then you can see that material threaded all the way throughout that program. But otherwise, I think it would be really advocating for curriculum committees to infuse small course assignments into a few different courses throughout their program. Hopefully that answers the question.
Thanks, Jen. Another question here that I know I can add a little bit to, but what are some strategies to use to advocate for ecoliteracy, specifically with politicians who do not believe that this is an issue? So I know from a CNA perspective, something that we do is bring evidence with us that are directly tied to the impacts of climate change on health, and also bring writing specific examples of, where emergency preparedness is needing, or, maybe there unfortunately was a natural disaster in that area as a direct impact of climate change. Jen, would you like to kind of add a bit more to this question?
No, I think that's a really good place, is to kind of, the evidence is strong in terms of the human health impact related to climate change. So I think it is really important to ensure that you have the evidence available. And so there are a few references included in our reference list that can kind of help guide you in terms of that scientific evidence. And then there are web links to gray literature that are included in the webinar slide as well. But there is strong literature that you can bring, and it is increasing, weekly, monthly. I'm coming across new research articles and that make the connection to different areas of nursing practice in relation to air pollution or extreme heat. And I know of various research projects that are funded and underway. So I think that we will only continue to see the growth of that evidence, and that's where we really need to focus the importance of the discussion is on that science that is available.
Thanks, Jennifer. So if you haven't, so that's the end of our Q&A period for today. Again, I would like to thank Jennifer for a fantastic presentation on ecoliteracy and climate change and health. Definitely lots to think about. You can access recordings of our webinars by visiting CNA's YouTube channel. You can also download files and your certificate of participation now by using the pods under the presentation. If you haven't already, please consider registering for the next webinar, Advanced Practice Nurses' Role in Opioid Stewardship, which will be held on Tuesday, June 18th, 2019, from 12 to 1 p.m. Eastern Time. Thanks again for your participation today. Goodbye.